It seems like every day there's a new headline about some miracle food that's going to like prevent cancer.
Mhm.
But then the next day there's, like another article saying, no, 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 don't eat that. That's like really bad for you.
It's enough to make anyone's head spin, right?
It really is. So how do we cut through all that noise and figure out what really matters when it comes to food and cancer?
That's the big question. Well, for this deep dive, we're going to be checking out this book. It's called Beat Cancer Kitchen, written by Chris Wark, who is a cancer survivor. And he's a big advocate for, like the power of food and healing. And we're also going to be looking at this really interesting YouTube video that features Dr. Dana Masala from the Mayo Clinic. And she talks about cancer-fighting foods. Oh, interesting. Both of those sources really emphasize the importance of food choices,
Yeah,
for supporting overall health. And they both talk about how, it could potentially reduce cancer risk, but they also make it really clear that this is not about like replacing conventional treatments. It's about empowering people with knowledge, to make informed decisions about their health.
totally. It's
Yeah.
about working with your doctor and being like proactive,
Yeah.
right? Taking an active role. Now, something that caught my attention in Beat Cancer Kitchen is how Chris Work talks about the potential risks of animal protein,
Yeah.
especially like in the quantities we consume today. I have to admit that made me pause because, well, I love a good burger every now and then.
Yeah, I think a lot of us do. It's totally understandable to like question that, right? Like how something that's so ingrained in our diets as meat, like what's the impact? Beet Cancer Kitchen actually breaks down like 6 components, in animal products that contribute to cancer growth. And they are saturated fat, cholesterol, then there's this growth hormone called IGF-1, and then heme iron. And then there's a sugar molecule called Nu5GC. And then finally, HCAs and PAH. And those are mutagenic compounds that form when meat is cooked at like really high temperatures.
Wow. Okay, 6. That's a lot of process. So are we saying all meat is bad?
Not necessarily, but it's really important to understand like why these components are linked to cancer. I think a good way to think about it is animal protein, especially in large quantities, it kind of floods our bodies with all these growth promoting and inflammatory compounds. And, some of those are necessary in moderation, but an excess can really create like the perfect storm for cancer development.
Right, that makes sense. So it's not about like avoiding meat entirely, but I guess being mindful of how much and what types of meat we consume. What
Yeah.
about those like scary sounding HCAs and PAHs?
Mhm.
I'm a big fan of grilling, but now I'm like a little worried.
Yeah, it's good to be mindful of your grilling techniques. HCAs and PAHs, they form when the meat is cooked at really high temperatures, especially when it's charred. And these compounds have been linked to a bunch of different cancers.
Okay, that's definitely food for thought. Here's an interesting question that Chris Wark brings up in his book. Haven't humans been eating meat for thousands of years? Why is it suddenly a problem now?
Well, it's true. Humans have evolved eating meat, but the amount and type of meat we consume today is just like drastically different than, what our ancestors ate. Factory farming, it's led to just like an unprecedented increase in meat consumption. And our bodies, they just haven't adapted to handle this, overload.
So it's more about the quantity and the quality of meat we're eating rather than meat itself. And it makes you think about the bigger picture of like how our modern lifestyle has really impacted our health.
So what about plant-based foods? I feel like there's a lot of conflicting information out there. I mean, I've heard some pretty negative stuff about legumes lately. What's the deal with that?
Oh, yeah. There's definitely been some fear-mongering around legumes like, beans, lentils, chickpeas. But the truth is they're nutritional powerhouses. I mean, they're packed with fiber, protein, essential vitamins, and minerals.
So they're a friend, not a foe.
Definitely a friend. And not only are they nutrient-rich, but they also contain this really powerful anti-cancer compound called IP6, or phytic acid. And this compound, studies have shown it can actually, like, inhibit cancer cell growth and even enhance the effects of chemotherapy. It's pretty amazing. Wow, that is amazing. This is why I love doing these deep dives. You always, like, uncover these fascinating nuggets of information. So we've talked about some of the potential risks. Now let's get to the good stuff. What specific foods do these sources recommend for potentially reducing cancer risk?
Well, both Beat Cancer Kitchen and Dr. Masala really emphasize the importance of a diverse and colorful diet, rich in fruits, vegetables, and whole grains. They talk about eating the rainbow for optimal health.
I love that. Eating the
Yeah.
rainbow. It's such a like visual, appealing way to think about healthy eating. So let's talk specifics. What are some of the standout superstars in the fight against cancer? What should we be like loading up on?
Well, both sources rave about cruciferous vegetables like broccoli, cauliflower, Brussels sprouts. They're packed with this compound called sulforaphane.
Okay, I've definitely heard, like, broccoli is good for you, but what exactly is sulforaphane? And what makes it so special?
Well, imagine, if you will, like broccoli is a superhero, right? And
Right.
sulforaphane is its superpower against cancer cells. Well, broccoli sprouts, those are like that superhero in its prime. They can pack up to 100 times the punch of mature broccoli when it comes to sulforaphane content. It's really impressive. And this potent compound, it acts as a detoxifier. It boosts the immune system, helps our bodies fight off those harmful invaders.
Broccoli sprouts.
Okay.
I've actually never even heard of those before.
Ooh, you can find them in most grocery stores these days. They kind of look like these tiny broccoli florets, and they have this slightly peppery flavor. Chris Work suggests adding them to like smoothies or salads for a really powerful nutritional boost. He even
Ex-
recommends like freezing them, which actually further increases their sulforaphane content.
Wow. Okay, that's a great pro tip. What other food should we be adding to our shopping lists?
Well, mushrooms. Mushrooms are another favorite. They've been shown to boost the immune system, and they may even enhance the effectiveness of chemotherapy and radiation treatments, especially like Asian varieties like reishi, shiitake, and meitak.
I love mushrooms. I usually just saute them and add them to like stir fries. Is there like a specific way to prepare them to maximize their benefits?
Well, Dr. Masala emphasizes the importance of cooking mushrooms thoroughly to eliminate this potentially harmful substance that's actually found on their surface. And the heat actually deactivates that substance, making cooked mushrooms safer and more beneficial.
Good to know. So we've got broccoli sprouts, mushrooms. What else? What other cancer-fighting foods are out there?
Berries. Berries are a must-have. They're loaded with antioxidants, and they've been shown to inhibit the growth of tumor blood vessels, essentially like cutting off their supply
Oh,
lines.
I love berries. So delicious.
Yeah.
And I know they're fighting cancer too. This is making healthy eating a lot more appealing.
Exactly. Eating for health doesn't have to be boring or restrictive. It's about finding those foods you enjoy that also nourish your body.
So true. Okay, so we've got our veggies, our mushrooms, our berries. What other cancer-fighting heroes are on this list?
Well, both sources highlight the anti-inflammatory properties of pineapple.
Pineapple. Now that's an interesting one. What makes it so powerful?
Well, pineapple contains this enzyme called bromelain. And bromelain has been shown to suppress cancer cell growth and boost immune function. So think of it as like a natural warrior, fighting inflammation and supporting your body's defenses.
Amazing. I'm really starting to see how food really can be medicine. Now, what about turmeric? I feel like I've been hearing so much about turmeric lately as like this, superfood with all these anti-cancer properties. What's the deal with that?
Turmeric, and specifically its active compound, curcumin, have definitely gotten a lot of attention lately, and for good reason. Studies have shown that curcumin has a lot of anti-cancer effects.
So should we all be like adding turmeric to everything?
Well, that's where things get a little tricky. Dr. Masala actually cautions against using turmeric supplements during chemotherapy because it can interact with certain medications. So it's really crucial to talk to your doctor before adding any new supplements to your routine, especially if you're undergoing treatment.
Okay, that's really important information. It's always better to be safe than sorry, and always best to consult with your doctor before making any like big changes, right? Especially when it comes to supplements and medications.
Absolutely. It's all about finding the right balance for your individual situation. And, while turmeric supplements might not be suitable during chemotherapy, it actually could be beneficial in survivorship, particularly for people who are at high risk of pancreatic cancer. Again, talk to your oncologist.
Got it. Okay, so we've got our cruciferous veggies, mushrooms, berries, pineapple, turmeric. That's a pretty impressive lineup. What other food should we be loading up on?
Well, both sources talk about the benefits of whole grains. They're a great source of fiber. And they also have this mineral called selenium, which has anti-cancer properties. And it might even reduce the toxicity of radiation.
Oh, interesting. I feel like I went through this phase where I thought all carbs were like bad, but it sounds like whole grains are a different story.
Yeah, it's all about choosing the right kinds of carbs. So whole grains like brown rice, quinoa, oats, those provide sustained energy and a host of nutrients that can support our overall health.
Okay. And what about leafy greens? I know they're good for you, but do they have like specific anti-cancer
Well,
properties?
they do. Leafy greens, they're packed with polyphenols. And polyphenols, they've been shown to protect and repair DNA, including the telomeres, which are like those protective caps on the ends of our chromosomes.
Telomeres. That rings a bell. Didn't Dr. Masala mention those in her video?
She did. Think of your DNA like it's an instruction manual for your body, right? Well, things like chronic stress and a poor diet can damage those instructions, increasing your risk of cancer and other diseases. So, leafy greens, they come packed with polyphenols. And they're like these tiny repair crews, they help protect and even fix that damage.
Wow. So we're not just fighting cancer, we're potentially slowing down the aging process too. Sign me up for that.
Yeah.
Okay, what other, notable foods did our sources mention?
Nuts. Both sources recommend incorporating nuts into your diet. There was one study that showed that just 2 servings of nuts per week could lower your risk of cancer. It's pretty impressive. And Dr. Masala also emphasized the importance of wild fatty fish as a source of omega-3 fatty acids.
Oh yeah, omega-3s, I've heard those are really good for brain health, but they have anti-cancer benefits too.
Yeah, they do. Omega-3s have been shown to enhance the effects of chemotherapy, improve survival rates, and even help maintain muscle mass in cancer patients. You can get them from fatty fish, like salmon, tuna, or through fish oil supplements. But again, it's important to talk to your doctor before you start any new supplements, especially if you're on blood thinners. And if you're vegetarian, flaxseed oil is a great plant-based source of omega-3s.
Got it. So nuts, wild fatty fish, flaxseed oil for those all-important omega-3s. What about organic produce? Is it really worth the extra cost?
Both sources recommend choosing organic whenever possible because it reduces your exposure to pesticides, herbicides, which can be harmful to your health. But they also acknowledge that organic isn't always accessible or affordable.
So what's a practical approach?
Well, Chris Work suggests checking out the environmental working groups Dirty Dozen and Clean 15 lists. And these lists, they rank fruits and vegetables based on their pesticide levels. So you can kind of prioritize buying organic for the most contaminated produce and then save money on the cleaner options. They even have this handy app you can download, like Reference, while you're shopping.
Oh, I love that. Okay, so we've talked about a lot of foods to add to our diets, but what about foods to avoid?
Well, we already talked about limiting red meat and processed
Right,
meats.
those are definitely on the naughty list. Anything else we should be watching out for?
Both sources advise against grilling meat too often, and they also warn about the dangers of sugar.
Sugar. I mean, I know it's not exactly healthy, but is it really linked to cancer?
Well, the average American consumes a staggering 170 pounds of sugar per year. And research has shown that this high sugar intake, it is linked to an increased risk of several cancers, including prostate, colorectal, and pancreatic cancers.
Wow, 170 pounds. That's a lot of sugar. So what can we do? Just cut it out completely?
Well, it's not always realistic to eliminate sugar entirely, but you can definitely make a conscious effort to reduce your intake. Start by reading labels, and choosing foods without added sugars. And when you do need to sweeten something, opt for natural sweeteners like dates or prunes.
Okay, great tips. What about alcohol? Where does that fall on the spectrum?
Well, alcohol is actually a known carcinogen. It's been linked to 7 types of cancer, and it's actually responsible for a significant percentage of new cancer cases and deaths.
Wow, I had no idea it was that serious.
It is. Both sources recommend limiting alcohol consumption. Dr. Masala specifically advises no more than 2 drinks per day for men and 1 drink per day for women.
Okay, why the difference between men and women?
Well, it's about how our bodies metabolize alcohol. Women generally have less of a specific enzyme that breaks down alcohol, so that means it stays in our systems longer.
Ah, that makes sense. Okay, so red meat, processed meats, grilled meat, sugar, and alcohol. Those are all on the foods to limit list. Anything else we should be aware of?
Ultra-processed foods. Both sources really highlight the dangers of those.
Ultra-processed foods, what exactly are those?
Think of those foods that come in boxes and cans, with that long list of ingredients you can't even pronounce. They're often loaded with additives, preservatives, artificial flavors, and they can negatively impact your DNA, your immune system, your gut health, and they can even accelerate cellular aging. It's pretty scary.
Okay, so basically if it looks like it was made in the lab, it's probably not good for you.
That's a good rule of thumb. Choosing whole, unprocessed foods is always going to be the best bet for your health.
Makes sense. So we've covered a lot of ground here, and it's clear that food plays a really powerful role in cancer prevention and overall health. But is it all about what we eat? Are there other lifestyle factors that can, influence our risk?
Absolutely. Both sources emphasize the importance of a holistic approach. They highlight things like stress management, exercise, even the importance of a healthy gut microbiome.
Okay, so let's talk about stress for a minute.
Sure.
We all have it, right? But how does stress actually impact our risk of cancer?
Well, chronic stress, it just wreaks havoc on our bodies. It weakens the immune system, it increases inflammation, it can even damage our DNA, and all of that can make us more susceptible to disease, including cancer.
So what can we do about it? I mean, modern life is just stressful.
It is, but both sources recommend incorporating like stress-reducing practices into your routine. Things like mindfulness, meditation, yoga, even just spending time in nature can make a big difference.
I love the idea of mindfulness and meditation, but I have to be honest, I don't know if I have time to sit and meditate for hours a day.
You don't have to. Even just a few minutes of like mindful breathing or a short walk in the park can help calm your nervous system and reduce stress. Dr. Masala also mentions the benefits of movement meditation like Tai Chi and Qigong.
I've heard of Tai Chi, but what is Qigong?
It's a mind-body practice. It involves like gentle movements, coordinated breathing, and meditation. It's been practiced in China for thousands of years, and it's known for its health benefits, including stress reduction and improved well-being.
Well, that sounds interesting. I'm definitely adding that to my list of things to explore. So we've got mindfulness, meditation, movement meditation. What other stress-reducing techniques are mentioned in these sources?
Acupuncture and acupressure.
Acupuncture I've heard of, but what's acupressure?
So acupuncture involves inserting these thin needles into specific points on the body to stimulate energy flow. Acupressure uses finger pressure on those same points to achieve, like, similar results.
Interesting. And do those techniques actually work?
There's growing evidence that they do. Dr. Masala mentions that acupuncture has actually been shown to be effective for managing various cancer-related symptoms and side effects, things like nausea, pain, fatigue, and even lymphedema. And for people who don't have access to an acupuncturist, acupressure can be a great self-administered alternative. There's even a specific pressure point on the wrist called P6 that's been shown to be helpful for nausea and vomiting.
Wow, that's incredibly useful. So acupuncture, acupressure, any other stress-busting tips?
Massage therapy.
Massage. That sounds more like, pampering than a medical treatment.
Well, it can be both, but medical massage, it goes beyond just relaxation. It's been shown to reduce anxiety and depression, manage pain, and even enhance the immune system.
Wow. Okay. I'm starting to see massage in a whole new light.
Mm-hmm.
Are there specific types of massage that are especially helpful for cancer patients?
Dr. Masala mentions that medical massage can be really beneficial for managing lymphedema, which is swelling that can happen after lymph node removal.
It's amazing. So we've got mindfulness, meditation, movement meditation, acupuncture, acupressure, and massage therapy. That's a pretty impressive arsenal of stress-reducing tools.
It is. And remember, these practices, they're beneficial for everyone, not just cancer patients. They're really all about supporting your overall health and well-being.
So true. Okay, we have covered a lot of information in this deep dive, and it's clear that food and lifestyle play this powerful role in cancer prevention and just overall health. But where do we go from here? It can feel kind of overwhelming to make all these changes all at once.
Oh, totally understandable. It's not about being perfect. It's about progress, not perfection, right? So just start by incorporating one or two small changes at a time. Maybe try adding a green smoothie to your breakfast routine or swapping out your afternoon soda for a cup of green tea. Just, little things.
I love that. Small steps can lead to big changes over time. And what about those of us who are already dealing with a cancer diagnosis? Is it too late to make these changes?
It's never too late to start prioritizing your health. While food and lifestyle changes alone can't cure cancer, they can play a crucial role in supporting conventional treatments and improving your overall well-being.
That's such an empowering message. So it's not just about preventing cancer. It's about giving our bodies the best chance to fight it and to thrive.
Exactly. And remember, this deep dive, this is just the beginning. It's sparked your curiosity. It's given you a foundation of knowledge. Now it's time to take that knowledge and, use it. Make informed choices that empower you on your health journey.
I'd love it. So what are your final words of wisdom for our listener?
Stay curious. Keep learning and exploring the connection between food and health. There's always more to discover. And most importantly, don't be afraid to advocate for your own well-being. You have the power to make choices that support your health and vitality.
Beautifully said. This has been such an insightful deep dive. I'm feeling inspired to make some changes, and I hope our listener is too. But before we wrap up, there's one more area we need to explore that's just as important as food choices: movement. Now, I'm all about moving my body. I love to dance, I love to hike, swim, but how does movement specifically help prevent cancer?
That's a great question. Dr. Masala points out that prolonged sitting is actually an independent risk factor for several cancers.
Really? Just from sitting? I have to admit, I spend a lot of time at my desk for work.
I know, a lot of us do. But the research is pretty clear. Sitting for extended periods without breaks, it can increase your risk of developing certain cancers. It's not fully understood why, but it likely has to do with things like reduced blood flow, metabolic changes, and even hormonal imbalances.
So what's the solution? Do I need to like quit my desk job and become a yoga instructor?
Not necessarily. The key is to incorporate movement breaks into your day. So even if you have a sedentary job, you can, get up and walk around every 30 minutes or so, take the stairs instead of the elevator, park farther away from the entrance. Those little bits of movement, they really add up over time.
Okay, that feels doable. I
Yeah.
can definitely make those changes. And what about like more structured exercise? How much do we need to be doing?
Both sources recommend aiming for at least 30 minutes of moderate intensity exercise most days of the week. That could be brisk walking, swimming, dancing, anything that gets your heart rate up.
Got it. So movement is key,
Mm-hmm.
both in terms of like reducing sitting time and incorporating regular exercise.
Mm-hmm.
Makes sense. So we've talked about food, lifestyle, stress management, movement.
Yeah.
What about the gut microbiome? I've heard that's really important for overall health, but what role does it play in cancer prevention?
The gut microbiome. It's an incredibly complex ecosystem, trillions of bacteria living in our digestive tracts, and it plays a much bigger role in our health than I think we previously realized. Dr. Masala explains that a healthy gut microbiome can actually strengthen our immune system, it can improve digestion, and it can even help protect us from certain cancers.
Wow, I had no idea it was that powerful. So how do we keep our gut microbiome happy and healthy?
Well, both sources emphasize the importance of eating a diverse range of plant-based foods. Fiber is particularly important because it feeds those beneficial bacteria in our gut.
Okay, so lots of fruits, veggies, whole grains. Got it.
Hmm.
What about probiotics? Should we be taking supplements?
Well, probiotics are live bacteria that can add to the diversity of your gut microbiome, and you can find them naturally in fermented foods like yogurt, kefir, sauerkraut, and kimchi.
I love sauerkraut. So eating those foods can help, but what about supplements?
Dr. Masala suggests that probiotic supplements can be beneficial for some people, especially people who've been on antibiotics, which can kind of deplete the good bacteria in the gut. But she also cautions that it's important to choose high-quality supplements and to rotate brands to make sure you're getting a variety of bacterial strains.
Okay, got it. So a diverse diet rich in fiber, plus those probiotic-rich foods, and maybe a supplement if needed. Okay, we've talked about what to eat, what to avoid, how to manage stress, how to move our bodies, and how to support our gut microbiome. It's amazing how all these pieces kind of fit together, right?
It is. It really highlights the interconnectedness of our bodies and how a holistic approach can make such a big difference in our overall health and well-being.
So true. Okay, we've covered a lot of ground in this deep dive. I'm feeling empowered to make some changes. But before we wrap things up, I'm curious to hear your personal takeaways. What stood out to you as like the most important or surprising information?
What's fascinating to me is just the sheer power of food. It's not just about calories or macronutrients. It's about these incredible compounds that can actually influence our cells and our genes at such a fundamental level.
I agree. I was blown away by the science behind like how specific foods can actually fight cancer, like those broccoli sprouts. Who knew something that's so tiny could be so powerful?
Right. And I also love the emphasis on the holistic approach. It's not just about what you eat or don't eat. It's about creating a lifestyle that supports your overall health and well-being.
Absolutely. And that's something that we can all do, regardless of our age or health status.
Hmm.
Okay, we've given our listener a lot to think about, but what's that one final provocative thought you want to leave them with? Something to really spark their curiosity and keep them exploring this connection between food and health.
I think the most important thing is to remember that our bodies are incredibly resilient. We have this innate ability to heal and thrive, but we need to give ourselves the right tools, and food is one of the most powerful tools we have.
I love that. Food is medicine. It's a concept that's been around for centuries, but modern science is finally catching up.
Exactly. We are just scratching the surface of understanding the complex interplay between food and our bodies.
So true. And that's what makes this whole journey so exciting, right?
Mm.
There's always more to learn and discover.
It's been fascinating, exploring the power of food choices and this whole holistic approach to health. And speaking of holistic, we can't forget about this, this other crucial element, movement.
Yeah, we talked about the dangers of like prolonged sitting earlier. And it's kind of mind-boggling that something as simple as just like sitting can actually increase our cancer risk. But we also know that movement is good for us in like countless ways. So how does it specifically help in the fight against cancer?
Well, regular physical activity has been shown to boost the immune system. It can reduce inflammation, and it can even help regulate those hormone levels, all of which can contribute to cancer prevention. It's like, giving your body's natural defenses a supercharge.
That makes sense. It's like we're giving our bodies like the tools they need to fight back against,
Yeah.
harmful invaders. But let's be realistic. A lot of us lead really busy lives and we struggle to like fit in regular exercise. What are some practical tips for incorporating more movement into our day?
You don't need to train for a marathon to reap the benefits. Even small changes can make a big difference. Remember those movement breaks we talked about earlier? Getting up and walking around every 30 minutes, taking the stairs instead of the elevator, parking farther away from the store entrance. These small actions, they really add up over time.
I love that. It's about finding those like little opportunities to just move our bodies throughout the day. It doesn't have to be like this huge time commitment.
Exactly. And, think about ways to make movement more enjoyable. Instead of forcing yourself to go to the gym, find activities you genuinely love. Maybe it's dancing, swimming, hiking, gardening, or even just playing with your kids or pets. When you enjoy what you're doing, it's so much easier to make it like a regular part of your routine.
That's so true. It's about finding what works for you and what fits into your lifestyle. Now, speaking of things that fit to our lifestyle, there's one more area I want to explore that's getting a lot of attention these days. The gut microbiome. I've heard it's like this, like whole ecosystem living inside of us. But how does it relate to cancer prevention?
The gut microbiome, it's absolutely fascinating. It's this complex community of trillions of bacteria that live in our digestive tract. And it plays a much bigger role in our overall health than we ever imagined. Research is showing that a healthy gut microbiome can actually strengthen our immune system, improve our digestion, and even influence our mood and cognitive function.
Okay, this is blowing my mind a little bit.
Yep.
So we're not just talking about digestion here. A healthy gut microbiome could be like our secret weapon against cancer.
That's a great way to put it. A balanced and diverse gut microbiome can help to create an environment that's less hospitable to cancer cells. Think of it like a well-tended garden where the beneficial bacteria, they thrive and they kind of crowd out the harmful ones.
So how do we cultivate a healthy gut garden? Is it all about eating those fermented foods we talked about earlier, like sauerkraut and kimchi?
Fermented foods are definitely a great way to, introduce beneficial bacteria into your gut, but it's also important to nourish those good bacteria with prebiotics, which are essentially the food that these bacteria thrive on, and the best source of prebiotics, fiber.
Okay. So back to those fruits, veggies, and whole grains we were talking about earlier. It seems like they're good for just about everything.
It's incredible, right? How those foundational foods just keep coming up. They really are the building blocks of a healthy diet and a healthy gut microbiome.
So we've talked about food choices, movement, stress management, and now the gut microbiome. It's amazing how all of these like seemingly separate pieces, they're all interconnected and they contribute to our like overall health and well-being.
It truly is. And I think that's, one of the most important takeaways from both Beat Cancer Kitchen and Dr. Masala's insights is this idea that a holistic approach is key. It's not about, obsessing over one specific food or supplement. It's about creating a lifestyle that nourishes your body and mind on multiple levels.
I love that. It's about taking a step back and looking at like the bigger picture rather than getting, caught up in all the minutia. But I have to admit, it can still feel a little overwhelming at times. There's just like so much information out there and it's constantly changing. It's hard to keep up.
I understand. It's easy to, get caught up in that information overload and then feel kind of paralyzed by all the shoulds and shouldn'ts. That's why it's crucial to remember that this journey, it's about progress, not perfection.
That's such a good reminder. It's about, taking small steps, experimenting with what works for you, and not beating yourself up if you, slip up along the way.
Exactly. And it's also important to remember that you don't have to do it alone. Reach out to your doctor, a registered dietitian, or other healthcare professionals for personalized guidance. There are also incredible resources online and in your community that can provide support and information.
That's great advice. So we've covered a lot of ground today. We've talked about the power of food choices, the importance of movement and stress management, the fascinating world of the gut microbiome, and, this empowering message of being your own health advocate. But before we wrap up, I want to bring it back to that personal level. What are some of your personal takeaways from these sources? What resonated with you the most?
What really struck me was the emphasis on hope and resilience, and not just in terms of preventing cancer, but like in approaching life in general. It's about recognizing that we have more control over our like health destiny than we often realize.
That's so powerful. It's not about, living in fear of disease. It's about embracing a lifestyle that nourishes our bodies and minds and empowers us to like thrive. And it
Yeah.
seems like that's, a message that resonates throughout Beat Cancer Kitchen as well.
Absolutely. Chris Wark's story is a testament to the power of the human spirit and the body's incredible ability to like heal when given the right tools.
I'm curious, what are some of the like tools that Chris Work emphasizes in his book?
He talks about, the importance of a nutrient-dense, plant-based diet, regular exercise, stress reduction techniques like meditation, and cultivating a positive mindset. He also emphasizes like connecting with nature, getting enough sleep, and surrounding yourself with a supportive community.
It's amazing how all those elements, they kind of weave together to create this like tapestry of well-being. It's not about one single action. It's about creating a lifestyle that supports our overall health and vitality.
Exactly. And I think that's, a message that's relevant for everyone, whether you're concerned about cancer prevention, managing a health condition, or simply like wanting to live a healthier, more vibrant life.
I couldn't agree more. So as we wrap up part 2 of our deep dive, what's one final thought you'd like to leave our listener with?
If I could leave you with one thought, it would be this. Remember that you are not a passive bystander in your health journey. You are an active participant, and you have the power to make choices that support your well-being. So stay curious, stay informed, and keep exploring all the amazing ways you can, nourish your body and mind.
I love that message of empowerment.
Yeah.
It's so easy to feel like our health is kind of out of our control. But you're right, we have more agency than we often give ourselves credit for.
Absolutely. And it's never too late to start making those positive changes. Every like small step we take towards nourishing our bodies and minds, it's a step in the right direction.
This has been such an incredible deep dive. And I feel like we've only just like scratched the surface of this fascinating topic. Is there anything else from either Beat Cancer Kitchen or, Dr. Masala's video that really stood out to you? Anything we haven't touched on yet?
One thing that really struck me was how both sources emphasize that this isn't just about, preventing cancer. It's about cultivating a lifestyle that like promotes overall health and vitality.
You're so right. It's about, feeling our best, having energy,
Right.
living a life that's like full of joy and purpose. And it seems like food plays such a like central role in that.
It absolutely does. Chris Warks, he even talks about food as like a form of self-love. It's about, nourishing our bodies with the nutrients they need to thrive. And it's about like savoring the flavors, the textures, the whole experience of
I
eating.
love that perspective.
Yeah,
It's not about like deprivation or restriction. It's about appreciation and enjoyment.
exactly. And when we approach food with that mindset, it becomes so much more than just fuel. It becomes like a source of pleasure, connection, and even healing.
This conversation has been so inspiring. I'm already thinking about like all the changes I want to make in my own life,
Yeah.
but I know it can be easy to get like caught up in the excitement, and then lose momentum over time. Do you have any advice for our listener on like how to stay motivated and make these changes stick?
That's such a good question. I think the key is to like start small and be patient with yourself. Don't try to like overhaul your entire life overnight. Instead, choose like one or two small changes that you can realistically implement and then just like build from there.
So instead of focusing on everything you need to change, it's about like choosing that one small step
Yeah.
and celebrating, those little victories along the way.
Exactly. And remember that setbacks, they're a normal part of the process. If you slip up, don't beat yourself up about it. Just acknowledge it, learn from it, and then just get back on track. Progress, not perfection.
That's such a great reminder. It's a journey, not a destination. And it's a journey that's worth taking, not just for the sake of, preventing cancer, but for the sake of living a healthier, more vibrant life.
Couldn't agree more. And remember, you're not alone on this journey. Reach out to your friends, your family, your healthcare providers for support. There are also amazing communities online and in your local area where you can, connect with like-minded people who share your goals. It really helps.
This has been such an incredible deep dive. And I feel like we've both learned so much. Thank you so much for, for sharing your expertise and your insights with us.
It's been a pleasure. I always love, diving deep into these topics, and it's been so inspiring to hear your thoughtful questions and reflections.
And to our listener, thank you so much for joining us on this journey of discovery. We hope you're feeling inspired and empowered to, take charge of your health and create a life that truly nourishes your body and soul. Remember, you have the power to make choices that support your well-being. And we're here to cheer you on every step of the way.